Project Lockdown enters its first weekend with news of a huge leap in the numbers who've tested positive and died. Miles of beaches in Brighton are today merely dotted with a very few solitary walkers. Its pier is deserted. The stay-home message is having an effect. The rise in the death toll will also have an impact. At the daily Downing Street press briefing, the business secretary replaced the infected Boris Johnson.
Can I be absolutely clear, is that the Prime Minister has had mild symptoms, but he's absolutely leading the response from the front. The government is totally united in ensuring that we combat this virus and that we bounce back the other side of it. So I want to be very clear about that, is that there are no gaps in government.
Gaps or not, the NHS is preparing itself for worse to come. A fleet of ambulances are to be stationed in the car park of London's Excel Centre, which is fast becoming a new makeshift hospital and mortuary. In just over 3 weeks, there have been 1,000 deaths. Forecasts suggest the next 1,000 will happen not in weeks, but in days. Restricting a final total to 20,000 is a tall order.
If we can keep deaths below 20,000, we will have done very well in this epidemic. We can beat this virus, we can reduce the number of deaths, but only if we reduce the spread and the transmission. Now is not the time to be complacent.
The new laws, the new restrictions, police reinforcement echoed the health chief's warning. This is not a national holiday, but a national emergency, was the stark message from chief constables. Richmond Park in West London barred all traffic and would only allow NHS workers and under 12s to cycle through the park.
It's a huge park. I cycled around the other day. It's fairly busy, but so long as we're social distancing, which obviously on a bike we are, it's a bit of a shame for local residents. So we're now going to go and cycle along the towpath, which I guess will be very busy.
I don't think people are taking it too seriously. Especially when we're just walking out now, we're just seeing so many people just standing in crowds. Yeah, doesn't make much sense.
I think we're definitely more conscious of the fact that that you shouldn't be out, if that makes sense, but I don't think I'm necessarily worried.
No.
This is also the weekend coronavirus testing of NHS staff has begun. The car park of Chessington World of Adventures in Surrey is no longer for thrill seekers, but has become the first drive-through testing centre for frontline health workers. But it's all happening 57 days after the first case of COVID-19 emerged in England.
Well, joining me now is Dr. Rosalind Eggo, an infectious disease modeller from the London School of Hygiene and Tropical Medicine. Could we begin by just explaining the figures that we've seen today and why they are what you have been expecting?
So the numbers of deaths have unfortunately gone up today, and this is because there's quite a big time lag from when somebody gets infected to if they unfortunately die, probably around 3 weeks. So that means that the deaths that we're seeing now are from people who were infected about 3 weeks ago, before these interventions went into place.
And so what do you expect to happen next? How long do you expect the number of deaths to keep rising?
Yeah, so these interventions aim to slow down transmission. And from when they start, when that transmission starts to come down and there start to be fewer new cases, then if we're looking only at deaths, then we expect to see that in about 3 weeks. So it's quite a long time, and that's why we need to really make sure that we're taking all the precautions now and not let up just because we don't see an effect straight away. It's going to take a bit of time to see that happen.
Is there any evidence yet that you can point to that says this is working? I mean, I'm just reading a release from a colleague, Professor Sheila Bird of the University of Cambridge, who was saying if we were following precisely the same trajectory as Italy, we would have seen slightly more deaths than we've seen today.
I'm not sure specifically about that comparison, but we do know that decreasing the number of contacts between people should slow transmission. And because of these time delays, so about 5 days from getting infected to showing symptoms, and about a week from showing symptoms to needing hospital care if you need it, then we'll be able to see a difference, a decrease in transmission first in the hospital care, cases, and then later in deaths. So there will be some indications sooner than 3 weeks that things are working, and we need to keep an eye on those.
And so is it as straightforward as saying that had we started this kind of social isolation a month ago, we would have avoided many of these deaths?
It's really difficult to say, but the key point now is that we are doing these measures and we've got to do them as well as we can for as long as we're asked to.
And do you think the measures are now going far enough, looking at the modelling, or could there yet be more that we need to do? I mean, obviously there are still reasonable numbers of self-employed, freelance and construction workers who are still moving around.
We'll have to wait and see and incorporate the new data into our models and really work out what effect this has had. So in our models, we have something called the reproduction number, the average number of secondary cases that each person creates, each infected case creates. And the goal of interventions is to push that number down below 1. And so we're going to need a bit of time to work out if that number has been pushed below 1. And if it has, the epidemic should start to shrink.
Dr. Ego, thank you very much indeed for joining us today. Now, the US government has approved the largest bailout in US history in an effort to combat the economic fallout of the pandemic. The move comes as record numbers of Americans apply for unemployment benefit, and 2 of the country's most populous states, New York and California, maintain a strict lockdown. The United States has already been confirmed to have more coronavirus cases than any other country, far outstripping Italy and China, and today reported another 10,000 cases. Aisha Tull reports.
The city that never sleeps seems like it's in slumber. New York's Times Square, one of the most recognisable places in America, quiet and deserted. If you know it well, it's very hard to get your head around. The United States is now leading the world in COVID-19 cases at over 100,000, an unenviable title. Over 1,500 people have died and millions of jobs have already been lost. And with those stark numbers comes another.
I'll sign the single biggest economic relief package in American history, and I must say, or any other package, by the way. It's twice as large as any relief ever signed. It's $2.2 billion, but it actually goes up to $6.2 potentially trillion.
Figures so large, even Donald Trump couldn't get them right. And with little social distancing around the Oval Office desk, the president was handing out pens to everyone. He seemed to be at odds with his own health advisors.
The coronavirus. This is their new hoax.
In one video by a Democratic campaign group, they say it's not the first time the president has given mixed messages to this crisis.
When you have 15 people, and within a couple of days it's going to be down to close to 0.
And they're not the only ones. Public health experts are also concerned.
The president gets on national television and he says one thing, then the National Institutes of Health gets up right after him and says the opposite. And then the president and governors are quarreling among each other and with the president. And Americans are confused, they're fearful, and they're just wondering, who's in charge.
But some governors aren't taking any chances. In New York State, they've opened 8 new hospitals. 3,000 miles away on the west coast in California, a hospital ship has arrived to deal with the thousands of cases coming their way. For an outbreak that President Trump once viewed as a virus far, far away, COVID-19 is now very much on his doorstep. With the new plan, he'll argue America's gloves are now off and the fight has begun. However President Trump tries to frame it, though, it looks set to get much worse before it gets better.